describe, is there a typical patient? Are they a certain age, or do they tend to be?
We actually have had a whole gamut of patients. We've seen some pediatrics. That's a little bit challenging just because the state has additional requirements. It's a little harder for them to get their ID cards, a little harder for the caretakers to get their ID cards, and plus they need a second physician to sign off saying that the risk and benefits of using marijuana is not as bad as the condition itself, which is absolutely the case for almost every patient, every pediatric illness.
So explain a little bit more about that type of patient. What do they
right,
what sort of conditions do they have?
So I have autistic patients, I have seizure children, I have one child with behavioral disorders, and he's just growing. They grow into adults and they become sometimes a little bit violent in their behaviors, and that's where, you know, something like medical marijuana can decrease the glutamate, and it does show to seem to decrease that aggressive behaviors. If they're unable to participate in their speech therapist, so I've had a speech therapy recommend them to me, sometimes that's how I get them, or just developmental therapists have kind of sent them to my way. It makes it hard that they can't even progress up, like from a poor deficiency, poor motor development and things like that. They can't move forward if they can't even control their behaviors. So this is just kind of a nice complementary thing to help them, help the family too.
Let's talk more about those adult patients. What sort of complaints and conditions do they come to you that they want marijuana for?
So the common conditions that are kind of like what I consider automatic approvals would be the patient with MS, stiff person syndrome, multiple sclerosis, that's what MS stands for. I have had some glaucoma patients, Parkinson's patients, and then you have the ones that are just debilitated from other kind of chronic conditions that they may have, whether it be rheumatoid arthritis, or maybe they're in a very traumatic accident with multiple fractures and now kind of left paralyzed. So really kind of everything, and my goal is to make sure that I'm improving quality of life. So I tried to emphasize this at the city commission meeting, is that I don't necessarily approve for everybody that has like a stub toe or an ache pain. Yes, it probably could do well, and it's used in natural remedies and home remedies in other countries, but here I have to really prove that there is a degree of disability for a patient before I can do a recommendation. So getting their records and proving that they've maybe had surgeries before, or they've failed multiple medicine trials previously. That seems to be the most of them.
What about palliative care, reducing pain and nausea? We hear about that a lot with cancer patients.
Yeah, no. So with cancer patients, the topic of whether it can do anything to help heal the actual cancer is one thing, but the palliative side effects that could be improved from medication is definitely obvious with the nausea and appetite and pain. But even as we become a little bit terminal, the excessive secretions that are sometimes building up that makes it hard to breathe, you know, ingesting marijuana actually decreases some of those excessive secretions. It helps them with their sleep. It helps them with anxiety. As a patient who has COPD and they're scared and get anxious about their last breath because they're on oxygen, it may not be a bad idea to give them a sublingual drop that can just help calm them down and take, you know, more organized breathing patterns.